Okay, good afternoon and welcome everybody to the most recent or May 2015 update to the DOPS Practice Monitor findings with our data through December of 2014. And we really thank you for joining us and also for your active participation in today's WebEx. A couple very quick points to make. So the DOPS Practice Monitor also reports CMS claims data on transfusions and hospitalizations specifically. And next slide, please. We have data through late 2013. There we go. First of all, on transfusions, there was a slight uptick in transfusions. This is percent of patients transfused per month with the introduction of the bundle in early 2011. And it's been pretty flat since then, roughly at 3 to 3.5% per month, or 3.5% per month. Next slide. I think most important and most important story is not the average across the country, but instead the variation amongst facilities, which we show here. So the 90th percentile versus 10th percentile at the bottom. This is percent of patients transfused over 6 months, ranges from almost 20% of patients at the top down to well under 5% at the bottom. So actually, there's essentially a fourfold variation in likelihood of transfusion depending on what facility a patient is dialyzed at. And that really is quite dramatic difference. And may reflect in part differences between patients, but certainly in part different approaches towards practice. My concern, of course, relates in particular to patients who may be transplantation candidates and the potential impact that this might have on finding an organ, a suitable organ. Next, please. Good news is that over time, the proportion of patients hospitalized has declined really quite steadily over the observation period. Next slide, please. At the same time, we see facility variation in hospitalization ranging, this is over 6 months, ranging from 50% of patients to just over 25%. So roughly twofold variation in likelihood of hospitalization, really depending on what facility one is dialyzed at. And again, some of this may be due to differences in patient characteristics, but some I think reflects differences in practice approach as well. Next slide. Right, we're actually at the top of the hour. We had just a concluding slide with respect to our findings, which is listed here. And in the interest of time, I think I'd rather not walk through those slides, but I can leave those up for folks. Before the hour is up, Brian, were there questions that we had a number of questions we have addressed offline electronically?
I think so.
Okay, good. Mark, we took the full hour. Do you have any closing comments or quick comments to put our findings in context?
Thanks, Bruce. I think certainly the last few slides that you referred to regarding hospitalizations as well as transfusions ties in very well with where CMS is headed with the QIP. They are looking at these elements, these new measures, in the next 12 to 24 months. They are part of the QIP for 2017, 2018, and specifically looking at hospitalizations, readmissions hospitalizations, transfusion rates. Certainly they're interested in expanding vascular access. There's some strong interest by CMS to expand that criteria to grafts as well. In other words, they're looking at the idea of allowing you to include grafts along with fistulas within the QIP to show that you're staying away from catheters. So I think that's certainly a good sign. I think the data presented today was very interesting. But clearly, what DOPS is looking at, I think, is exactly in the same direction that CMS is probing and trying to get information from facilities. So I think it's spot on.